manual therapy techniques I'm going to use for this patient. We're going to start with improving C1 on C2 rotation left at the upper cervical. I suspect is stiff. So I'm actually, I'm going to remove the pillow for a little bit just to get a better view here. And also I'm supporting his head on my stomach here. So I find C2, which is the first prominent spinous process after the occiput. My right hand, again the side of my finger here, is going to come onto the transverse process of C1, while my left, this one here, is on C2 because I'm going to stabilize C2 so that I can then use my right to bring C1 around. So what I'm doing is I'm trying to get my left on C2, my right on C1, and I'm cupping the occiput so I can bring that kind of with it and improve that rotation there. All right. Next is we're going to improve, and those are grades 2, 3s, and 4s. Because I think we need range of motion there, and I don't think it'll irritate his symptoms down lower. Then we're gonna do right side bending. So I'm gonna bring him into a little bit of rotation left. Actually, yeah, a little bit of rotation left, where I'm then going to take my right hand on the occiput, holding onto C1 on the left, and then I'm going to side bend to the right. Now I'm doing it this way because these motions are coupled, rotation left at C1-2 with side bending right, and so in neutral the patient might be okay with some side bending, but if we were to then try to combine the two, it might be a little limited. So I'm bringing them into a little bit of rotation left. I'm holding the transverse process of C1 here and kind of giving it a little bit of a anterior lateral glide to hold it still while I bring the occiput around into side bending to the right there. So bringing it into that rotation to then facilitate kind of the motion that's supposed to happen of occiput on C1 there. All right. Then we have C6 is where I suspect the mobility is hypermobile, and I want to address pain modulation mostly there. So I'm going to bring this pillow back in for patient comfort. Good. We can rest there. And all I'm going to do is grade 1 lateral glide. So my right hand, I'm going to find C6. We start at T1, C7, C6. My right hand is going to go onto the transverse process of C6 on the right. I'm going to keep C5 on the left transverse process just right here. I'm going to move my right to move C6 to the left a little bit for some of that grade 1 pain modulation that I think the patient will benefit greatly from. All right. So again, on the spine model. So this is C6 here. So I take C5, my right hand, C6 with my, left hand, right hand, and I'm just kind of stabilizing here with like a V shape with the spinous process and the articular pillar, I should say. And then C6 gets a little glide to the left there. Grade 1s. All right, and then the last thing I would like to do is muscle energy, utilizing muscle energy for improving left rotation at the upper cervical. So we're gonna again go into that where C2, my left hand has C2 transverse process, or articular pillar. My right has C1 transverse process. Left kind of holds C2 there while my right rotates C1. And I'm gonna have the patient, I'm gonna have you try to turn right gently. Hold, 2, 3, 4, 5, and relax. Good. Take up some of the range, turn right. 1, 2, 3, 4, 5, and relax. Good. And then I can kind of reassess his range there. All right, so those are the manual therapy techniques I would use for this patient.